All right. Hey, everybody. Welcome back to the GEMS podcast. I am joined today by someone who probably needs a little introduction if you've been around the EMS space for very long. But I'm excited that we're going to be welcoming him to GEMS at FDIC for 2026. So I'm going to kick it over to the one and only Tom Bouthillet.
Hey, good morning, Mike. How's it going?
Oh, wonderful. Excited to be here.
Good. So, what do you want to talk about today?
Well, we're here to talk about the cardiology masterclass, right? The 4 hour workshop that you're going to be presenting at GEMS at FDIC in April of this year. Well, if you're sitting there reading the course description and you're like, "Is this a class I really want to take?" What do you feel is that piece that's really going to say, "Yeah, I've got to be there. I can't miss that one."
I think for a long time I've really prided myself on being someone that really translates things like 12 lead ECG interpretation to paramedic field practice. Like, so it's not pie in the sky stuff. I like it to be kind of field friendly, and by that I don't mean dumbed down at all. I mean just understanding the pressures that paramedics and pre-hospital professionals face, the kind of undifferentiated populations that we encounter, all the different reasons we might do a 12 lead ECG. And so, what I do, or at least what I try to do, is teach paramedics to think in terms of pretest probability, obtain a 12 lead ECG with excellent data quality, and then give them a roadmap for interpretation, what I call the 6 step method. But what I do is kind of demystify it from the standpoint that, yeah, we look at rate and rhythm and things like that. We talk a little bit about axis, but we're not going to like make people's eyes glaze over, anything like that. And I spend a lot of time talking about what a normal 12 lead ECG looks like, because believe it or not, that's kind of a neglected topic in electrocardiography. And if you don't have a strong grasp of normal, it's kind of more difficult to understand when you're dealing with something that is abnormal, let alone when something goes from abnormal to even more abnormal, like in the case of a left bundle branch block or something like that. And so we cover things like occlusion myocardial infarction and that paradigm, because it kind of seems like the term STEMI has run its course. We invent all these terms like STEMI equivalents or semi-STEMIs and mimics and all these different things. But what we really want to do is make sure that we understand all the different presentations that would indicate that a patient has an occluded artery, because this is one of the most satisfying diagnoses in pre-hospital medicine to make, from the standpoint that it's life-threatening, it's time sensitive, but a paramedic that has good clinical judgment, good clinical skills, and the ability to read a 12 lead ECG can get these patients the help that they need in a timely manner, and these patients can have excellent outcomes. And so I think for all of these reasons, they should consider spending some time with me in this pre-con.
And those are exactly all the reasons why I reached out to you and why I wanted this course at FDIC so badly. And I'm beyond excited about you being there. We're also pairing your course on the same day after someone takes your cardiology masterclass. They can go take the Maryland Resuscitation Academy resuscitation course. So what it does is it brings together a pairing of how do I identify these sick patients, and if I'm not able to get them to that care in time, how can I best resuscitate them if we're not able to get them to that definitive care before that worsens into something like cardiac arrest. And that's what the Resuscitation Academy is then going to be helping us out with. So I'm just really excited to be able to bring that pairing together for a resuscitation masterclass, because yours is the recognition and goes beyond just that of the cardiac patient, but all the other areas where that ECG is very beneficial to us. So I'm super excited. I can't wait to can't wait to see you in person in April. If there is anyone watching or listening to this that doesn't know who you are, do you want to tell us a little bit about yourself?
Well, right now I'm the policy accreditations and ISO manager for Chatham County Fire Department, which is, right, Savannah, Georgia is that area. I'm the retired battalion chief of EMS for Hilton Head Island Fire Rescue, longtime supporter, by the way, of the Resuscitation Academy. So Dr. Seaman and Kelly Durthick are good friends of mine, and we've used the 10 steps to improve cardiac arrest survival on Hilton Head to excellent effect. Probably see this picture hanging on my wall right here of our staff doing Seattle's high performance CPR, tracking outcomes with the CARES registry, and just really perfecting rate, depth, recoil, controlled ventilations, shocking on a 2-minute cycle, and the perishock pause. All the things, when combined with things like rapid dispatch and telecommunicator CPR, that we know improves outcomes, especially when we partner with our colleagues at the hospital to make sure our patients are getting evidence-based post-resuscitation care. So I really appreciate you bringing up the Resuscitation Academy. I think that would be an awesome day if someone spent 4 hours in the morning talking about electrocardiography and then went right over to the Resuscitation Academy. That's the kind of thing that could be transformational. So if you're going to FDIC and you're bringing your communications manager or your fire chief or your operations chief or training chief, anything like that, this is where you can build a coalition and attack two time-sensitive diagnoses, namely occlusion myocardial infarction and sudden cardiac arrest in one day, and get some really truly outstanding information. Because it time sensitive diagnoses, I know we like to say nowadays response times don't matter and things like that. You hear this whole mantra, but I have a suspicion that a lot of EMTs and paramedics got into this business because they really did want to save lives. And then they got into the business and said, wow, EMS isn't like that at all. I'm doing all these things other than saving lives. Well, guys, acute coronary syndromes and sudden cardiac arrest is one of those areas where you can make a huge difference. Um, I think we spend a lot of time in EMS thinking about individual performance and individual education. You need this number of CEUs. You got to pass this test. You're being checked off on these skills. We don't spend enough time talking about team performance, and we don't spend enough time talking about system performance. And if you care about clinical quality and quality improvement, you have to care about all three domains: the individual performance, the team performance, and the system performance. And so this can be part of your journey. And what I have personally found in systems that have gone on this journey and have improved outcomes, it kind of reconnects EMTs and paramedics to the reason that they got into the business in the first place before they became burnt out and cynical and tired and stressed out. When you save lives, it just feels good. It's a sacred responsibility to give someone their life back, and it makes you remember why you got into this business in the first place.
Yeah, absolutely. There's no better way to say it than that. And I do want to say that some of the groundbreaking and foundational things that you did while you were at Hilton Head, was what really that's when I first started to follow the work that you were doing, and some of the education that you started putting out there. And I've personally attended your cardiology masterclass in the past, and I can't tell the audience how many pearls I was able to take away from it, and how it really transformed and advanced me as a provider. So my deepest, most sincere thanks to you and everything that you've done. And I think you were very humble about the things that you did at Hilton Head, and some of the remarkable things that a lot of that weren't happening in a lot of other places, but really showed some true benefit to that community. So hats off to you, sir, and I can't wait to see you in April.
Well, thanks for saying that, brother. I'm happy to report that Hilton Head Island Fire Rescue is still thriving, and still provides world class fire suppression, urban search and rescue, hazardous materials response, and emergency medical care. They do a fantastic job. And I think that's important because what it shows is when you go on this journey and you make these changes, they can be sustainable. A lot of times what happens when we target something for improvement, you see a Hawthorne effect, you pay attention to it for a year, maybe two, you see outcomes get better, but then you change your focus and move on to something else. And I'm very proud to know that Hilton Head Island is still a community where you have an excellent chance of surviving bystander witness shockable cardiac arrest.
Awesome. Well, thank you, sir. I appreciate it. And thanks for your time today. And hope everybody enjoyed this.
Pleasure. Thanks for having me.
All right. We'll see you in April.
Thanks, man.